Contraception, commonly known as birth control, is the practice of preventing pregnancy through three primary biological mechanisms. It involves stopping the ovaries from releasing eggs, preventing sperm from fertilizing an egg, or preventing a fertilized egg from attaching to the uterine lining. Understanding these processes is the first step in reproductive health. These three mechanisms are scientifically known as preventing ovulation, conception, and implantation. By interfering with these specific stages, various methods can effectively manage family planning. Whether it is blocking the physical path of the sperm or altering the hormonal cycle, each method targets a specific part of the reproductive process. Contraceptive methods are generally categorized as either temporary or permanent. Temporary options, such as birth control pills or intrauterine devices, allow for future fertility once the method is stopped. In contrast, permanent solutions like vasectomy or tubal sterilization are intended for individuals who have decided they do not want children. It is essential to distinguish routine contraception from emergency options and abortion. Emergency contraception is used specifically after unprotected sex to help prevent an unintended pregnancy from occurring. This is distinct from abortion, which is a medical procedure used to interrupt an existing pregnancy that has already been established. The effectiveness of any contraceptive method is measured in two distinct ways: perfect use and typical use. Perfect use refers to the effectiveness when the method is followed exactly according to instructions every single time. Typical use reflects how the method performs for most people in real-world scenarios. For instance, oral contraceptive pills are highly effective under conditions of perfect use. However, their reliability in the real world often drops because doses can be missed or taken at inconsistent times. This gap highlights how much a method's success depends on the user's ability to follow a routine. In contrast, long-acting reversible methods like intrauterine devices or IUDs have nearly identical perfect and typical use rates. Because these devices require no daily action or maintenance once they are inserted by a healthcare professional, they eliminate the risk of user error, making them one of the most reliable. Interestingly, the gap between typical and perfect use often decreases over time. As users become more accustomed to their chosen method and integrate it into their daily habits, they tend to follow instructions more closely. This increased consistency leads to higher reliability and a better overall experience with birth control. Several external factors can influence how well contraception works, including natural fertility. A couple with normal fertility has about an 85% chance of pregnancy within a single year if no birth control is used. It is also important to note that fertility naturally declines as individuals age over time. Additionally, certain medications can interfere with the effectiveness of hormonal contraceptives. For example, the antibiotic rifampin is known to reduce the efficacy of many hormonal methods. However, it does not affect the levonorgestrel-releasing IUD. Always consult with a healthcare provider about potential drug interactions when starting new medications. When choosing a method, individuals must consider their personal preferences, medical history, and the level of reliability they need. There is no one-size-fits-all solution, and what works for one person may not be suitable for another. A thorough discussion with a medical professional helps determine the best lifestyle alignment. While some methods are more effective at preventing pregnancy, condoms offer a unique and critical advantage. Specifically, latex and synthetic varieties provide protection against common sexually transmitted infections, including HIV. This dual benefit makes them a vital tool in public health, providing a barrier that hormonal methods simply cannot offer. Because of the protection they provide against infections, health experts recommend using condoms as part of safer sex practices. This recommendation holds true even when another form of birth control, such as the pill or an IUD, is already in place. This dual protection approach ensures the highest level of safety. Ultimately, the goal of contraception is to empower individuals to make informed decisions about their reproductive health. By understanding the mechanisms, effectiveness rates, and additional benefits like STI protection, you can choose the method that best fits your needs. Informed choices lead to better health outcomes and greater peace.